My name is Jacqueline Pye. I'm the Senior Research Lead for the Canada FASD Research Network, and I'm proud to be part of CanFASD. CanFASD Research Network is a national not-for-profit organization. We work hard to have all Canadians engaged and united in terms of our awareness, the evidence and knowledge around how we're effectively addressing the complexities of FASD. We do this by concentrating our efforts in the areas of research that will have the most impact for people with FASD, such as interventions, justice, child welfare, and of course, prevention. Our network does not give out lots of money, but we work hard to use the little funds we have to bring researchers together with families, service providers, government folks, and other researchers to better understand key areas that have been identified as important. We turn the evidence into meaningful resources and tools. Check out our website for some of these or follow our blog at canfast.ca. The Sterling Clarin Award is provided to researchers, new researchers, emerging researchers in Canada that are contributing original, innovative, creative work to our understanding of FASD. We're really excited. I know in reviewing applications this year, there are so many strong students in Canada. This is really exciting. And I'm so excited to see the new researchers that are coming up and shedding new light on how we think about FASD, how we understand it. I think it's going to change everything that we do and help us to evolve. Maybe I'm just thinking I've kind of got an old brain and done things a certain way for a long time. And I'm really excited by the young minds that ask me questions and challenge me to think in new and exciting ways. So this award is really an opportunity to showcase and acknowledge some of the excellence in the work that's being done in these new students. And of course, we had to name it after our beloved Sterling Clarin, one of my favorite people in the whole world. His name is well recognized in the field of FASD. He was CanFASD's CEO and scientific director when the organization began 15 years ago. We are thrilled to have Dr. Clarin with us today. He's going to share a few words and announce our award recipient and our topic.
Thank you, Dr. Pye. It is always an absolute pleasure to briefly come out of retirement and join the network and all of you, and to be making this presentation to John with an audience of 100 people in the land of COVID is truly spectacular. You know, fetal alcohol syndromes is a diagnosis that was coined literally 50 years ago. And I worked in the field from about 1975 until I came to Canada 15 years ago, doing clinical work and doing research. But I was so excited when the job in Canada opened up, because it was an opportunity to inform government about this condition and change public policy. It's not gone quickly. And it didn't seem like it was going quickly for a lack of research data. We had tons of important work done all over the world and done in Canada that we thought should make big changes. It's made little changes. We've studied knowledge transfer. We've tried to use that field to better understand what it would take to bring this condition to public attention. And now we have an international calamity, which is certainly sucking the oxygen out of all chronic problems in our country. What will happen when COVID-19 settles down? We don't know. We can hope that there will be a pivot for people to come together and to start solving a large number of social problems more quickly. And so it's in this environment that John Aspler's talk becomes really so important. Here's a young man, a PhD candidate from McGill in neuroscience, who has been looking broadly at the field of neuroscience in terms of what are the obstructions to transferring knowledge about the brain into work in society. It's very exciting, and it seemed to be a perfect talk when we reviewed a very strong field of candidates last year, and now it seems to me mission critical. And so I will happily now get out of the way and turn this over to John, and we will all listen, I think, with great interest to what he has to say. John?
Thank you. Thank you so much for that introduction. Let me just share my slides with all of you. There we go. Yeah, so thank you so much for that introduction, Dr. Clarren and Dr. Pai. I'm really honored to have been chosen as the award winner for this year's Sterling Clarren FASD Research Award. And yeah, as much as it would have been really fun to give this talk in person in Vancouver, I'm just delighted by the size of the audience we seem to have online. So thank you all so much for being here with me. What I'm planning on doing is basically running you through all of the key findings and all the things I did throughout my PhD research, which is coming to a close soon, which is mostly about how the Canadian news communicates information about FASD, alcohol, and pregnancy, and how members of the FASD community feel about that news coverage. And so, but before I do that, I want to tell you a little bit about myself and why this is a project that interested me and how we got here. So I guess when I was studying neuroscience as an undergraduate student, and I started to gain a little bit of knowledge about how science works and how neuroscience works in particular, I started to notice as I was reading and watching news coverage of neuroscience facts and findings that a lot of the information was pretty sensational, pretty hyped up. Sometimes it was the opposite. It was very doom and gloom and very uncritically negative. And so that was something that really inspired me to care a lot about science communication. And I realized initially, I naively thought that it was a problem with news itself, that, you know, journalists aren't scientists and they don't totally get the science sometimes. Maybe editors create sensational headlines. And while those can absolutely be challenges in communication, as it turns out, it's much more complicated than that. And scientific experts, health professionals, public health experts as well, sometimes get the message wrong, or the message is sensational and confusing. And so when I came into my PhD, what I was really interested in was looking at neuroscience in the news and understanding what information was communicated to Canadians about neuroscience research broadly. But as I thought more about that, I realized I actually cared about the human dimension a lot more than the science dimension specifically. What kinds of stories do we choose to tell, and do we choose not to tell about people with neurodevelopmental disabilities, for example? And so that's what I'm going to be focusing on today. Those stories, the potential stereotypes associated with those stories, and the potential stigma that various people in the FASD community, from folks with FASD themselves, to their mothers, to their adoptive parents, to the professionals who work with them, might also experience in connection to those kinds of stereotypes. And there are a lot of people that I need to thank, all the people in my research unit, my thesis committee, and all of the organizations like CanFASD, Citizen Advocacy in Ottawa, who supported this work directly. And so thank you all so much for your help. So just to give you a quick overview of what my project actually entails. So like I said, the first thing we wanted to know was, or at least the thing I was interested in, is what information is being presented to Canadians about neurodevelopmental disabilities. And eventually I narrowed that question down to FASD specifically, rather than, say, autism or cerebral palsy, for a number of reasons, including the fact that at the time, FASD was very much the understudied diagnosis among the other neurodevelopmental disabilities. And also, unlike some of those other diagnoses, FASD is unique because it doesn't just tell us something about the individual with the diagnosis, it tells us something about their mother, rightly or wrongly. And that leads to a whole host of challenges associated with stereotypes that aren't just about stereotypes associated with people with disabilities or with FASD, but also associated with women who consume alcohol during pregnancy. So ultimately, the first study we did, the question we asked was, what information is actually presented to Canadians about FASD, alcohol, and pregnancy? And to understand that, we did something called a media content analysis, which I'll describe a little bit later in the presentation. And then based on that analysis, you know, I had feelings and thoughts about what the right way to communicate about FASD might be coming out of this news analysis, but I realized that the news that we were seeing talked about a lot of different people, and sometimes included a lot of other different people, like people with FASD or their parents. So we wanted to know, what do they think about that coverage, and how would they look to improve it if they saw any problems with it? So we did a second project that was a stakeholder engagement project, looking at what the reactions of various folks with FASD might be, and other people in the FASD community might be, regarding that news coverage. And then finally, moving beyond the research themselves, the ultimate thing we want to answer is, what should we do about it? Based on the findings, what do our participants recommend we do to improve communication around FASD, alcohol, and pregnancy in the public sphere, but not just in news, in health messaging, and not just in public, but in more intimate conversations between doctors and patients, or between social workers and parents? How can we improve that conversation if there are challenges associated with the way that information is conveyed about FASD, alcohol, and pregnancy? So I'm going to start by talking a little bit more about why we did this work, but specifically the theory behind it. I'm going to define a few terms like stigma and stereotypes, and I'm going to talk about a field of research called disability studies, and some of the results that have come out of that field over the last few decades, looking at how disabilities in general, not FASD specifically, have been portrayed in the news and in literature and fiction. Then I'm going to actually talk about what we did. I'm going to present to you both of those research projects, the news analysis and the focus group, and connect them back to that theory. And then finally, I'm going to talk about what I think we should do about it, but not just what I think, what our participants thought in terms of how we can improve that discussion. And one of the things I do want to say right off the top is that in my experience, when I've given talks about this work, which is qualitative work, looking at people's experiences, understanding words and ideas, sometimes the information or the ideas and experiences I'm sharing are difficult experiences or negative experiences. And that can be hard sometimes for people to hear, or maybe it resonates too much with them and it's difficult for them to sit through. So I do just want to put out there that I will be talking about a lot of difficult experiences that people with FASD may have faced and may have told me about directly. And I also want to emphasize that I am focusing on negative and I am focusing on challenges, because those are the things we can improve. Lots of people I spoke to talked about their positive experiences, their accomplishments. Lots of the news I saw was great news coverage, was nuanced, was accurate, and provided all the context that we would want to better understand the situation around FASD, alcohol, and pregnancy. But I will be focusing down mostly on the challenges, because I think that's where there's room for improvement. So ultimately, the core assumption at the heart of this work is that information can potentially influence understanding, and that can have an impact on how people are perceived and how people are treated. And, obviously it's a lot more complicated than that. In the current era of misinformation, I think it's pretty clear that people don't just read a news article, uncritically take in every piece of information and believe it all, or maybe sometimes they do, and that's also part of the problem. But when it comes to a topic like FASD, which is a diagnosis that is not terribly well known about or understood in the public sphere, and a topic as sensitive and complicated as alcohol and pregnancy, that's sort of a bit of a perfect storm to really encourage a certain kind of discussion and possibly influence understanding in ways that could be a problem if the information presented is problematic. So one of the key concepts, like I said, driving this research is an understanding of this concept called stigma, and the way that stigma is part of the lives of people with FASD, as well as women who drink while pregnant. And a lot of people use the word stigma in a lot of different ways, and I just want to quickly give you a definition so that whenever I say stigma, hopefully this is what will come to mind for you. And it's a definition that comes from some work that was done in the early 2000s, where stigma was described by these researchers or by these scholars as a process that has to have 5 things that have to happen all at the same time for stigma to happen. So what do I mean by that? We label differences all the time. I have brown eyes, maybe you have blue eyes, but that's a totally trivial difference, and we don't typically discriminate against people based on eye color. We don't typically have stereotypes associated with people based on eye color. But that's not necessarily the case for a lot of other more complicated topics like religion and intelligence and diagnoses, because one kind of labeled difference would be a medical diagnosis. It's literally giving someone a diagnostic label. So in my work, I'm really focusing down on these two parts of this overall model, and I'd be happy to talk about stigma in general and these other components like othering and discrimination and power at the end, but I'll be focusing on labeling differences. Maybe that's FASD, maybe that's the label alcoholic or something like that. And then the stereotypes that sometimes become associated with those labels. And of course, what's a stereotype? A stereotype is a common way to describe entire groups of people and individuals within that group, even though there are obviously huge differences between individuals. And so to talk a little bit more about stereotypes, I mentioned that I wanted to focus a bit on the field of disability studies and some of the very common stereotypes that scholars have identified in news coverage about disabilities in general, whether it's physical disabilities, whether it's intellectual disabilities. A set of common stereotypes and ideas arise. And the first of those that I'll talk about is the victim stereotype. And I do just quickly want to flag that it's not that people with disabilities can't be victims of things or that we shouldn't tell stories when they are victims. The challenge is that if the only stories we choose to tell are ones that focus so much on this one story or this one kind of stereotype, that we wind up missing the varied and diverse and rich experiences of all people with disabilities. Everyone experiences joys and sadness and isn't simply always a victim. And so it's important for us to make sure that the stories we choose to tell don't fall into a single or one or two or three different categories. So the victim stereotype is one where individuals are portrayed as objects of pity or objects of tragedy. And what I mean by objects is that we typically don't, or a lot of these kinds of stories often don't actually include the person that they're talking about as a subject of the story. They're not telling their own story, someone's telling their story for them. So they become an object of pity for readers or viewers to consume, to feel different ways about, to feel sadness on their behalf, to feel pity for. And like I said, this is something we see in fiction and literature, but also in news coverage. So just to give you a couple quick examples, Tiny Tim is sort of the quintessential example of the victim stereotype in literature. If you don't know Tiny Tim, he is a character in Charles Dickens's A Christmas Carol, and he is not really a point of view character. He is a very sickly child who, throughout the story, might die. And the fact of his possibly dying because of his very physically sickly nature is used to help develop the character of Scrooge, and is also used to help the reader feel positively or negatively about Scrooge and about the situation. Tiny Tim isn't really a person. Tiny Tim is a one-dimensional caricature of a person with a disability. But that's maybe too easy an object of criticism. He's a character in literature. So I want to give you a more relevant recent example from our political discourse. So this is an image that some of you may recognize from 2015 or 2016. It was when President Trump was presidential nominee Trump. And he was seen in this image on the right, or possibly on the left. He was seen making fun of a reporter with a physical disability. And one of the things that I don't know if you noticed or if you were aware is that a lot of the ways that the information was shared was through this image on Facebook or through news articles with headlines like "Disabled Journalist Mocked by Presidential Nominee." But one of the things that was missing centrally from that story was his name. This is Serge Kowalewski, who is not only a disabled journalist, but he's also a Pulitzer Prize-winning journalist. He's a Pulitzer Prize-winning journalist who has written for both the New York Times and the Washington Post. And the fact that his identity was often erased from the stories that we told in order to communicate a political message, an important political message, because of course we shouldn't be making fun of people for their physical differences. And yet, nonetheless, that was what wound up being communicated, that this person who wanted to be the president mocked a disabled reporter, and we removed that person from his own story. And I just want to read you a quote from a speech that Meryl Streep gave at the Golden Globes that really, I think, crystallizes exactly this problem. Meryl Streep said, "It was that moment when the person asking to sit in the most respected seat in our country imitated a disabled reporter, someone he outranked in privilege, power, and the capacity to fight back. It kind of broke my heart when I saw it." And that really is just the quintessential example of people with disabilities being used as objects of pity. It broke her heart. She doesn't name him. She doesn't explain that he's a Pulitzer Prize-winning journalist. None of that comes out. He's simply reduced to a person whose physical disabilities were mocked. He's an object of her pay. So the next stereotype I want to highlight is kind of the opposite of that. It's the stereotype of the hero. And again, there's nothing wrong with having stories about role models or having complicated stories about individuals who face challenges and who also have a great deal of positive experiences or strengths. The problem with the hero stereotype is that it often leads people with disabilities to be seen as objects of inspiration. Again, they're not the subjects in their own stories. They're people who are framed for the consumption of often people without disabilities. They're not role models for other young people with disabilities. They often wind up becoming parts of memes, like this meme here. The only disability in life is a bad attitude. And that's something that's often called inspiration porn, where individuals with disabilities are shown to the public or to people without disabilities, with the idea being, and sometimes literally the text on the screen saying, "What's your excuse?" And one of the challenges about that is that heroes remove the need to accommodate, because if the only disability in life is a bad attitude, then why would anyone need support from communities, from healthcare services, from social services in order to succeed or in order to achieve success in their lives? And the last stereotype I want to highlight, which I've highlighted in yellow here because it will be the most relevant to our conversation about stereotypes around FASD, is the stereotype of the villain. So again, to come back to literature as an easy way in, if you look, for example, at Shakespeare's Richard III, Richard III has a physical disability or a physical difference. He has a hunched back. And one of the things that's important about this portrayal is that the character, based on, of course, the real person, the character is portrayed as, and this is not a word I endorse, it's simply how it's often described in the literature, as having a twisted soul that is reflected in his body. So the idea is that not only is he evil inside, but his outside looks like he's evil. And if you haven't seen Richard III, maybe an example that you have seen is The Lion King. And in The Lion King, the villain's name is Scar. So his name is literally marking the physical difference on his face. It's not necessarily a disability, but it is a physical difference that makes him appear more villainous. And that might be something that's relevant in the lives of people with FASD, because roughly 10% of people, maybe, we're not 100% certain, have characteristic physical features in their faces. And so that's something that I was looking out for. I don't know that I necessarily found it in the news coverage, so I was happy to see that, but typically we do often mark physical difference as a potential demarcator of villainy or of criminal behavior. And it's not just physical, it's also mental illness or intellectual disability, and that's something we see in the news as well. For example, mental illness as a cause of gun violence. So ultimately, I'm going to be talking about how some of what we found in our news media connects back to these stereotypes, especially the stereotype of the villain, because we did see a great deal of coverage in news about FASD, talking about jail, criminal behavior, people with FASD getting into trouble with the criminal justice system, and the stereotypes that might be associated with that. Okay, so just a quick reminder, we did this media content analysis, and so that's what I'll talk about next. Then we did a series of focus group interviews where we talked to members of the FASD community, and ultimately I'll be telling you what they said about what we should do, keeping in mind the stereotypes and the concepts I've just talked about. So that first project, a media content analysis, is a way of identifying and studying news coverage over time across different sources to understand what kinds of stories we tell, what kinds of narratives are present in a particular kind of news, as well as what kind of themes or common ideas come up when we look at an entire set of articles over time. So we did an analysis that included about 300 news articles published between 2002 and 2015 that came from the top 10 English language Canadian newspapers. I do just want to flag that we didn't purposely choose to only focus on the English language media. We had a few difficulties associated with the databases we were using, but beyond that, we actually found it really hard to find news in French Canadian media that would have been worth including in our study. So while I don't really have anything beyond that observation in my work, I do think that it's an important limitation and that there's definitely room to look at French Canadian media as well as comparisons between what English and French media might be saying in Canada. So based on that analysis, we identified 14 different themes. And I'm not going to be describing these 14 themes, although I'll be more than happy to come back to this slide and talk about some of these in detail later. What I do want to focus on again is that the third most common theme we identified, so a theme that popped up in, I believe, 106 out of our 290 something articles, is the theme of crime. So the idea that there was a story that was in some way connecting criminal behavior to FASD. So I'll come back to that after. So when we were looking through the media coverage of FASD, alcohol, and pregnancy, we identified these themes, but we also identified some challenges associated with how that information was presented. And so some of that had to do with science and health communication, to go back to my original interest in neuroscience in the news. And some of what we found was exaggerated coverage of, exaggerating beyond a scientific study to come to conclusions that might not actually be supported by the facts, or contradiction between different articles, which could ultimately lead to a certain amount of confusion. For example, contradiction about the potential impact of alcohol on fetal development. And I will come back and give different examples for each of these different challenges. And the third thing we identified in science and health communication as a challenge is contextlessness, or the idea that scientifically accurate information might be presented, but without the social context to actually provide explanations as to why something is happening. And how even getting the science right, doesn't necessarily mean that we're going to avoid challenges associated with stereotyping and stigmatization. And then on the other side, within these 14 themes, we also identified a series of more social themes or human interest stories that were less about how much alcohol is okay or not okay, or scientific facts or scientific research being done about FASD, but more stories about the lives of people with FASD, their family members, etc. And the key challenge we identified there was ultimately assumptions, expectations, and stereotypes. So to jump back to the science and health communication angle, there were those 3 points of discussion: exaggeration, contradiction, and contextlessness. So we found a number of different examples of each of them, but I just want to give you one example from each category to really, I think, make the point, talk about a little bit about what our concerns were around exaggeration, why this might be a problem, and understand how this is relevant to the conversation about FASD, alcohol and pregnancy, and stigma and stereotypes. So in the case of exaggeration, the relevant example here is the rate of FASD we see in Indigenous communities across the country. If I go back to our themes slide, you can see the theme of Indigenous, which comes up 62 times out of our roughly 300 articles. So 1/6 of articles connect Indigenous communities to FASD, alcohol, and pregnancy. And already that's something that I'm not going to be getting into in too much detail, but that's a whole talk in and of itself concerning the stereotypes associated with Indigenous people and alcohol and FASD. But the specific concern here is that a lot of these articles, about half of them, when there were some that had great coverage, but about half of them would have a sort of uncritically phrased sentence that would say something like, Native people in Canada face FASD at a much higher rate than the general population. Or FASD is a bigger problem in Indigenous communities than in urban centers, or something like that. And so I wanted to understand where this was coming from. And so I looked into the scientific literature on FASD prevalence in Canada. And one of the first things that you would notice is that there are basically no studies that have been done outside of Indigenous communities. Most of the studies have been in Indigenous communities, looking at rates of FASD. They've been done, and this is specifically studying the rates of FASD. Lots of research has been done about FASD in all sorts of places, but we've studied prevalence in Indigenous communities, in rural communities and remote communities, usually in remote Indigenous communities, as well as in criminal and incarcerated populations, and sometimes the overlap between Indigenous people and incarcerated populations. And there have been a few studies, at least in the last couple of years, looking more, I think there was a study that came out looking at rates in Toronto, which are, I think, typically we say that the general population is 1% to 4% of the general population has FASD, but a lot of that is still based on outdated data from the 70s, 80s, 90s coming out of other countries like the States. So it wasn't surprising then that the coverage in Canadian news would say this is a bigger problem for Indigenous populations when we don't actually have studies coming out of other places. We overstudy it in Indigenous populations, and we're also looking usually at some of the hardest hit communities. So we're looking at a particularly remote or rural community of 70 people, and we find that 7 people there have FASD, and suddenly Indigenous communities the country over have an FASD rate of 10%, when that's simply not the case, and we can't actually extrapolate past those findings from that one community to say that this is a bigger problem everywhere else. So our biggest concern about this kind of exaggeration is that it can perpetuate stereotypes and really pernicious myths about Indigenous peoples and Indigenous communities. And that's not to say that some communities and some people don't face these challenges in higher numbers than in other places, but it's not fair to say that this is a problem for Canada's Indigenous population, as it's sometimes praised in the news, when we don't really have the data to support that statement. The next point I want to make, I'll make it a little briefer, is about contradiction. And this had to do with the amount of alcohol consumed during pregnancy being associated with fetal harm. So some articles in our sample said something like light drinking during pregnancy, without ever really defining light drinking. Light drinking during pregnancy harms fetal development. Some articles said light drinking during pregnancy has no effect on fetal development. And a few articles, a very small number, said light drinking during pregnancy could be beneficial for fetal development. And I obviously want to quickly mention that, of course, it is not beneficial for fetal development, and I'm happy to talk a bit at the end of this presentation if you have questions about what was going on with that study. But broadly speaking, the news is reporting on totally different studies coming out with different results. So this is partly a problem of not providing the appropriate context for an individual study in the news, like what have other studies previously found, but it's also a genuine challenge of scientific uncertainty, because in the literature, we don't have all the answers, which is why the public health messaging typically says that because we don't know the amounts, the timing, or any of those things, the most prudent choice is simply not to drink during pregnancy. So when we have this kind of contradictory messaging, the concern is broadly that it could cause public confusion. And so one of our suggestions was to find a better balance between reporting on a new study, and that's just part of the structure of news. A new study comes out, so that might lead to a new headline. So yeah, you want to report on that new study, but put that new study in the context of the broader scientific literature. Tell us what other studies have found before that. Talk about the scientific uncertainty, address it head on, and also balance that with public health messaging, talking about the best health advice. Not every article did that. A lot of these articles were, or a few of these articles were what we sometimes call journalism, the idea that you take a press release from a scientific or health source, you reword it a little bit, and then you shove it out to the public. And that can be a problem when you're not taking the time to address it in the broader context of the scientific literature. And both of those points, exaggeration and contradiction about Indigenous prevalence and alcohol safety, really sort of end us on this third key point about accuracy without context. So for example, in the context of Indigenous prevalence, only 2 articles in our entire sample talked about residential schools, or talked about the socio-historical, socioeconomic context of certain Indigenous communities. And without that context, these scientific facts potentially become harmful, because we need to put all of that information together to have the complete picture. So the example that I typically use comes from this particular quote from the Calgary Herald in 2005. Fetal alcohol syndrome is an entirely preventable disability. This was a very common way of describing FASD at the beginning of an article. So it wasn't part of a discussion about prevention even. It was just sort of this sentence that was repeated in a lot of different ways. Some articles said it was 100% preventable, highly preventable, the leading cause of preventable disability, totally preventable, most preventable, completely preventable, fully, so preventable. And the reason that I raise this point is because it's an interesting one. It is technically correct. If a fetus is not exposed to alcohol in the womb, that child won't be born with FASD. True. However, it's not really 100% preventable. If it were, probably we would have prevented it. The problem is that there are so many complicated reasons why someone might be consuming alcohol during pregnancy. Women often face difficult situations involving abuse, Maybe they are challenged by substance use issues. Maybe they didn't know they were pregnant and they stopped drinking when they found out, but they had already consumed alcohol prior to finding out. Maybe they don't know about the connection between alcohol and pregnancy. There are lots of complicated reasons that could have an influence on why someone is drinking. So yeah, it's absolutely true that FASD could be understood as preventable like that. But I don't think it's the whole story, and those kinds of uncritically descriptive sentences at the beginning of the article, I think are unhelpful in really getting to the bottom of what might be happening here. Now to turn to the human interest stories and what we found in the news media, not just about science and health communication, but in the way we presented the lives of people with FASD and their families and the professionals who care for them. So the first, unsurprisingly, pointing back to what we found as our third most common theme, being the connection between FASD and criminal behavior, was this stereotype of people with FASD being framed like villains. A lot of our coverage talked about people with FASD having committed violent crimes. A lot of that coverage casually connected people with FASD to criminal behavior. And of course, the problem here is that, while yes, absolutely, some people with FASD wind up in jail. Some people with FASD do have a number of challenges that might be associated with criminal behavior. First, it's certainly not everyone. And if those are the only stories we tell, that's a problem. And second, it's when we don't provide, again, when we go back to that point of contextlessness, a lot of these stories simply say this person was arrested for committing this particularly violent crime. But we don't necessarily have the context that maybe that person was raised in the foster care system in a group home, which is not the best place for the average kid in general. But when it comes to a kid who has much higher support and structure and accommodation needs, that might be a contributing social factor in that person's trajectory. Of course, again, it doesn't have to be, but it is an additional piece of context that would have been helpful in those kinds of stories. And otherwise, sometimes we're left with these stereotype portrayals of people with FASD as villains. And the contrasting, sort of the mirror image of that story, is the story of people with FASD as victims. Victims of who? Victims of their mothers. And I'll come back to mothers in just a moment. But in terms of the victim stereotype, this was generally less common than the stories about people with FASD being connected to criminal behavior. But one of the reasons why it's so important to frame is that some researchers and scholars have pointed out that when we talk about FASD and the lives of people with FASD in news or even in the medical literature sometimes, there's often this dichotomy where sometimes people are portrayed as victims, usually innocent children, victims of parents, until they become deviant adults destined to commit crimes. And I'm saying those things, they're not true, of course. They are simply how we see in news media and in certain kinds of health communication the lives of people with FASD, and that's something we need to change. So, and one other very, very important point here, and it's the reason I presented the hero stereotype to you before, is that in fact, in news coverage about FASD, alcohol and pregnancy, the hero stereotype is absent. There are absolutely some good stories looking at successes, looking at accomplishments, looking at a combination of strengths and weaknesses, but at the same time, there was no presentation of any stereotype that associated people with FASD with this sort of heroically achieving above and beyond. Excuse me. And what that suggests to me, especially when taken with the fact that we have these two other stereotypes, these villains and these victim stereotypes, is that the coverage about FASD and about people with FASD in their lives is not the most hopeful coverage. The conversations we have about FASD and people with FASD doesn't contain the most positive message that will help us provide role models for people with FASD. And again, that's not always the case. Some of the news coverage was truly excellent. And since 2015, there have been an increasing number of articles that truly are told from the perspective of people with FASD, with role models and with really amazing stories coming from the community itself and not being observed from the outside. But even so, I did want to highlight that without the hero stereotype here, I think it really frames the coverage that I found as relatively negative and hopeless. And that leads to the very last stereotype I wanted to highlight, which is not a disability stereotype, but instead has to do with our expectations and understanding of women who've consumed alcohol during pregnancy. I mentioned before that saying it's 100% preventable misses the point, or misses the story, or misses so many complicated reasons why someone may have consumed alcohol during pregnancy. And that's the same here. When we frame a woman who consumes alcohol during pregnancy as a bad person, as someone we should judge, as someone who is the only person responsible for what's happened to their child, that becomes, again, a potential stereotype that could stigmatize that population, and that could have very real health effects that could make it less easy for them, or make it more difficult for them to reach out for help. This hasn't happened in Canada, to my knowledge, but in the States, for example, a number of states actually have laws on the book where if someone uses substances during pregnancy, not just alcohol, they can be charged with child abuse or with child neglect, depending on the state. And that's a policy implication, or that's a conclusion that I don't think we ultimately want to get to, because it's something that really stigmatizes women who consume alcohol during pregnancy, and again, makes it difficult maybe for them to reach out for help. And I'm not trying to say that media coverage will necessarily lead to that and to putting women in jail for drinking. I do just want to highlight that there are different social responses based on different social understandings and values. And if these are the kinds of stories we tell about women who drink while pregnant, we definitely need to change them. And so to jump ahead a bit, moving into conversations about the focus group study that I did, I want to leave this media coverage section with a quote from one of my participants. She's a woman with FASD who herself consumed alcohol during her pregnancy. And she reflected a little bit on, what this meant, and the fact that she originally thought that her own birth mother was a bad person, but that ultimately, because of her circumstances, she grew to understand what had happened. And it's not a longitudinal study with 1,000 people, showing all of the different complicated factors, but it is one person's story that hopefully pushes back a little bit against the stereotype of the bad mother. I drank with one of my kids, but I never thought she'd make it, and I never thought I'd make it. I thought my ex-partner was going to kill me. I started understanding my mother because my dad was exactly like my ex. I made a really, really big mistake. With my mom at first, I thought it was stupid. I thought she was stupid. But the more that I try to understand why she did it, how can I not forgive her after I've done it too? And this is not the participant's real name. All of the names I'm going to be showing are anonymized, fictional names. And this participant was in the second group of adults with FASD I spoke to, so that's what FASD2 means. So I just want to leave you with that quote again, as a way to understand the complicated situations that could lead to someone consuming alcohol during their pregnancy. So now to move into the second part of our research, where we took our media coverage and our analysis of it and showed it to key FASD stakeholders, we conducted a series of focus group interviews. So those are interviews where we have 4, 6, 8 people in a room together. They're all typically from the same stakeholder group. So we spoke to a group of adults with FASD, and we spoke separately to a group of caregivers, including adoptive parents, foster parents, etc. And it's through their conversations together that we're able to come to certain kinds of conclusions. Sometimes there's disagreement and debate, and it can get difficult and heated because these are very sensitive topics. And sometimes there's consensus building, where people work together to find a different kind of outcome or conclusion to a discussion. So these were 2-hour-long semi-structured interviews, and ultimately I included 3 different groups of people, over 12 interviews total. Adults with FASD, so we did 4 interviews with a group of adults. I think we had about 20 adults with FASD who participated in total. 4 interviews with groups of caregivers, and I should say up front that almost all of these caregivers were adoptive, foster, and kinship caregivers. Kinship caregivers are typically when, for example, the grandparent or the uncle might be taking care of the child, maybe even as their legal guardian. And we did not have very many biological parents, and that is a limitation of the study. Because obviously, if we're going to be talking about alcohol consumption during pregnancy, it's important that those people have a voice in explaining and talking about their difficult circumstances or what happened in their lives. And so we do, like I said, have some of those adults with FASD who themselves have kids with FASD, and they sometimes were able to bridge that gap in sharing their thoughts and feelings. And the final group of people we included, and again, 4 separate focus group interviews, were different kinds of professionals. So that included, for example, doctors, nurses, social workers, And even within those categories, there were some pretty big differences between what each of those groups of people did. We had some social workers who participated, who were working primarily supporting women who were facing substance use challenges. And so they were in the best case scenarios where they were helping people, they were helping women who were usually pregnant manage those concerns. And then on the other end, we had social workers who were working in child protective services who often saw the worst case scenarios, situations where they had to take kids out of homes. And so they had very different reactions and suggestions for what we should do. And I'm not going to be getting too much into the details about what each of these different groups had to say, but I'm more than happy to start taking that apart again in the question and answer period. Oh, and maybe the last thing I should say is that these interviews happened all across Canada in major urban centers. So our focus group data can be divided into 4 different categories of information that we collected. Personal narratives, so people saying, this is what my life is like, or answering the question, tell me a little bit about yourself. And then to return to the definition of stigma that I gave before, which started with labeling difference and stereotyping, the second set of questions we asked had to do with the diagnostic label. So treating it specifically like labeling difference as part of that model. And so those were questions like, what's it like to receive a diagnosis? Or what's it like to find out that your child has FASD? How do people react when you tell them? Do you even choose to tell them? Why or why not? What are barriers to disclosing your diagnosis or your child's diagnosis? The third category of questions had to do with stereotypes. So even before I showed participants media quotes and parts of our news analysis to ask them for their feedback, I simply asked them, what kind of stereotypes have you experienced or have you heard or do you think exist about FASD, as well as about alcohol and pregnancy and women who consume alcohol during pregnancy? And then finally, we shared our media sample with participants and we asked them some very narrow questions. We showed them some specific quotes and we asked them to make suggestions for how to improve that data, or sorry, how to improve a particular sentence. So we did a lot of wordsmithing to find the best ways to express ideas, but also we had very broad conversations. They'd seen all of the media and I asked them, you know, what do you think we should do about this? What kinds of stories should we tell? Did they get it right? Why or why not? So first I'm going to focus down on the stereotypes part, although I'm happy to return to the personal narratives or diagnostic labels or any other parts of what you might be curious about regarding this data and the experiences of people with FASD and their family members. But I'm going to focus down on participants' responses to my questions about FASD. And firstly, in response to the question again, do you think that there are any stereotypes about FASD? Have you experienced them? Have you heard them? What are they? So one of the first answers I often got from mostly healthcare professionals and parents, not so much from adults with FASD, was the idea that actually the public doesn't have enough information for there to even be stereotypes. That might be like in this quote. When you asked the question, I thought, wow, it would be nice if there was a stereotype. I mean, you know, that at least people would understand the disability enough that they could give it a stereotype. So the idea there just being that public understanding is not where it needs to be, for there even to be an ability to stereotype someone, which is good, but is also not great if that means very low awareness. But even with that kind of response, every group talked about potential stereotypes, either things they'd experienced or things they worried about. And those were broadly broken down into some categories that had to do with the things that we expect people with FASD to be able to do or not to do. And again, these are stereotypes, so they're not true. They're simply the things that my participants had to say when I asked them, what are the stereotypes? So the first set of stereotypes has to do with their abilities. So here's a quote from a participant. I've heard from many, many people that we are just mentally challenged or look different, we're deformed, can't do anything. We sit at home, we don't go to school, we just sit there and look at a wall and do nothing. So this stereotype, of course, has to do with, you know, intellectual assumptions about that individual. There are people with FASD who are studying in PhD programs. So, you know, the idea that everyone with FASD has a serious intellectual disability is simply not the case. The idea that they can't learn or can't do anything, we'll see the potential concerns around that on the next slide. Another set of stereotypes the participants identified were trajectories. So where are people's lives going? What's going to happen to them if they have FASD? And one of those kinds of trajectories that people were concerned about are those outcomes. So here's a quote from a healthcare professional. So for example, they might assume that individuals with FASD, either drink a lot, do drugs, commit crimes. And this was in the context of a conversation where that person was saying, yeah, people think that people with FASD might just ultimately wind up in jail, which is, again, not true. Some people do, but that's not what's going to happen to everyone. And that connects back to the stereotypes we identified in the news, the idea that some of these outcomes are going to lead to these very negative places, and in particular, the idea that they are hopeless and this is their destiny. It's not, and that's something that we can push back against. The other kind of trajectories, instead of looking forward, the participants were talking about, they were looking backwards. What kind of life has someone lived? And what do people assume the kind of person who has FASD might look like, or what has their life been like? And so that might be something like the assumption that a child with FASD must be Indigenous. My child's not Native. So that's, again, another important thing to push back against, the idea that it's certain kinds of people who have FASD when that's not the case. So the final part of this conversation, I asked participants, okay, so you've identified a bunch of stereotypes. You told me that you're worried that people think that people with FASD are mentally challenged, or they sit and stare at walls. What are you concerned about? What do you think those stereotypes could mean in your life, or could mean for people with FASD in general? There were a lot of different answers, which, for example, had to do with negative attitudes towards people with FASD. But I wanted to highlight, I think, two specific concerns that are really worth looking into and exploring further. The first has to do with the kinds of support that people with FASD might receive. So just to give you a quick quote, we see now in places where different service providing agencies restrict access to individuals with an FASD because they won't benefit from the service. They have an FASD. So the idea here is that when we have negative stereotypes that people with FASD can't learn, that they sit at home staring at walls, that everyone's mentally challenged, that this could potentially have an effect on the kinds of support that people with FASD actually receive. So if the message is hopeless, the support might not be there. And this is a quote from a healthcare professional reflecting actively on practices in the field. So that's the kind of thing that participants were concerned about and suggesting that we needed to push back about with different kinds of stories. The other one I wanted to communicate to you is the idea of a self-fulfilling prophecy. So this was something that was mostly talked about by adults with FASD themselves, although a little bit by caregivers. And the idea here was that in seeing consistently negative and hopeless stories about FASD, this could become a self-fulfilling prophecy. Here's a quote from one participant. Saying they're going to rob a bank, steal a car or something, yes, some of us will. But I find that stereotyping that gets into our heads, and then we start feeling, well, because people say that, well, now we have to be like that. And I can't say how often that kind of idea came up. I had other participants say things to me like, well, I was an active kid, but my teacher started to say that I was a bad kid. And I thought, well, I'm not bad. But then, I kept hearing that. So I said, okay, well, I guess I'm bad. And so, again, without positive stories, without role models, with stories that focus too much on these negative outcomes and on these negative, on these expectations around abilities, that could potentially have a very negative effect on the self-esteem and the outcome of individuals with FASD themselves. And again, that's something we need to push back against. So next I want to turn to stereotypes specifically about women who drink while pregnant. So this, this was divided a little bit differently, but ultimately comes to a very similar place. So the first set of stereotypes, which is I think the easiest category to understand, are assumptions about what kind of person might consume alcohol during pregnancy. So, substance users, low-income women, people who don't have an education, teens, Indigenous women, and of course, these are all differently marginalized communities. And those are the people that we assume, that people might assume have FASD or are likely to drink alcohol during pregnancy, when again, that's not the case. It could be anyone in any community. Another stereotype that we've already talked about quite a bit in terms of the bad mother stereotype are stereotypes about someone's character. The idea that a woman is drinking alcohol during pregnancy because she's selfish and wants to harm her fetus, that she's a bad mother, that she's worthy of our blame and of being shamed. When again, there are lots of difficult and different reasons why someone might have consumed alcohol during pregnancy. And then the last set of stereotypes that were identified were behavioral stereotypes. And what that means is, what do people think a woman who's consuming alcohol during pregnancy might be behaving like or might look like during their pregnancy? So the biggest example of that came up a lot was the idea that someone must be drinking really heavily. They must be seriously struggling with substance use issues, drinking, a bottle of something very heavy a day. When again, that's absolutely not the case. There are lots of other different ways of drinking during a pregnancy that can still lead to FASD. So again, I asked my participants, okay, you've described these stereotypes, what are your concerns about them? So the first one is a concern that came mostly from caregivers, and in particular, adoptive and foster caregivers. So it's the idea that the stereotypes about, specifically the demographic stereotypes, the idea that FASD only affects marginalized communities, as well as in particular the character stereotypes, the idea that the kind of person who drinks during pregnancy is a person. That makes disclosing the fact that their child with FASD is adopted very difficult for them. Here's a quote. I had one person say to me, "Oh, you're dealing with addiction issues? That was when I was brave and didn't say I was an adoptive parent." Yeah, it's a tricky one to not put that word adopted in there too. It puts adoptive and foster parents in really difficult situations, because if everyone is judging and blaming women for drinking during pregnancy, as soon as someone says, my child has FASD, another person, another person could react and wonder and have that judgment and change the way they react to you, because now they have a whole other set of assumptions about you that might not be true. But on the other hand, should you really have to constantly disclose that your child is adopted when you start talking about FASD? That doesn't seem fair either. So that was one major concern, mostly raised by caregivers. And then another one is something that I've simply called here, can't happen to me. It's a quote directly from a participant, which is why it's in quotation marks. And this one specifically refers to the demographic stereotypes. So if we assume that the kind of person who drinks during pregnancy is indigenous, or is poor, or is low income, that means that although those stereotypes absolutely could negatively affect those marginalized communities, which are already marginalized, it could also have a bit of a backfire effect where other kinds of people who don't fit those stereotypes or who don't fit those demographic categories, might not think that FASD could be something that could happen in their lives. Here's a quote from a participant. If you're not a Native person, then it's like, oh, you can't have FASD, which is not true at all and sort of prevents them from getting help. I can see a middle-class mom who finds out her child has FASD saying, oh gosh, I thought only moms who were falling down drunk could have a child with FASD. And this was a really interesting and challenging finding, because half the time the concern was to say, absolutely, the problem is that it allows certain kinds of people to say, I'm not that kind of person, or this can't happen to me. But sometimes it actually created a new kind of stereotype. It was now assumptions about middle-class moms who don't know anything about alcohol and pregnancy, when they can still be facing difficult circumstances. It's not like abuse is something that only happens in low-income settings. It's not like substance use is only a challenge faced by low-income women. So there was this, again, interesting double-edged sword that came up with this particular idea. But broadly, I thought it was really important to highlight that there was this concern that if we emphasize a certain kind of population is more likely to have FASD, other people might say, not my problem. So that's everything I wanted to say about stereotypes. And now I want to move into the reactions to media section to really wrap everything up and connect the theory section, all the different disability stereotypes, to the media section and what we found in the news, to what our participants had to report about their lives and about the stereotypes they worry about. So I've divided my participants' recommendations into 5 different categories. They're a little bit simplified, and I'm more than happy to try and unpack some of them with you in the Q&A section. But really what I do want to emphasize is that these are not my suggestions, these are, participant recommendations. And I do have some suggestions on how to act on those recommendations, which I'll reflect on at the end. So the first recommendation is we need to include. We need to include people with FASD in the stories that are about them. We need to include caregivers in the stories that are about them and their children. We need to have more inclusive coverage that doesn't frame people with disabilities or with FASD as objects for other people to feel things about, as objects of pity. We need them to be subjects in their own stories. So here's one example of that suggestion. We take kids like us and we speak about it. We center the experiences of key stakeholders at all times. We have role models, not the hero stereotype, but people who, have faced challenges, but also have succeeded even with those challenges, who can help support younger people with FASD as they grow up. We need to tell those stories, and we need to be more inclusive about those stories. The second suggestion is hope. We need to push back against the kind of hopeless coverage we sometimes see, with the villain and victim stereotype being one of the predominant kinds of stereotype portrayals. And here's an example of that from a healthcare professional. So I think the message of hope is critical for people affected by it, but also for caregivers and also for service providers. We can't give up on them. So that has a bit to do with, again, the idea that if we have these stereotypes that people with FASD can't do anything, then if we have no hope, then maybe we give up. And we shouldn't, because of course there is hope and we can communicate that hope. A third idea was that we should educate people. And I don't just mean in the sense of have more awareness campaigns and things like that. Participants were suggesting fundamental shifts in the way that we do health education in schools, for example. Maybe it has to be part of our education system. When we start teaching people about sex and about etiquette and dating, it needs to be a part of that conversation. So sure, awareness campaigns absolutely help, and participants recommended that too. Continue doing that work, continue having FASD Awareness Day, etc. But find a way to work this into school curricula so that it helps destigmatize and clarify issues around alcohol, FASD, and pregnancy. A fourth suggestion was to focus not just on the individuals who might be consuming alcohol during pregnancy, so maybe a group of at-risk women, for example, but focus the message down on the community as a whole. And before I show you that quote, I do just want to quickly highlight that the idea of inclusion and hope, those were ideas that were mostly brought up in the context of how do we tell better stories about people with FASD. The conversations about educate and community, these are conversations that have to do with how we better provide information about alcohol and pregnancy and about women who drink while pregnancy in the public sphere. That might be something like, maybe something like support your partner, she's not drinking, you don't drink either. So, those were suggestions like support your partner through their pregnancy. If you have a friend in your friend group who is pregnant, don't plan a bar night, plan a games night at home or a bowling night or something like that. Find ways to engage the community and not just blame and shame individual women. Share the responsibility and provide support for each other. The last suggestion that came up sort of is a bit different than these others. And because these are my participants' recommendations, I really want to reflect their views and the things that they raised, even if I have some different feelings about them or different reactions to them. And a fairly common idea that came up is the idea that we still need to scare, shock, or provide fear-based messaging for the public. So for example, fear is a huge motivator. Look how successful that campaign about drinking and driving has been. I think the issue is we want women to know that if they are pregnant and they drink, there are significant risks involved for their fetus. And I totally understand that. I think that's a very reasonable way to feel about how we should communicate about FASD, alcohol, and pregnancy. But I also think it's interesting that it does sometimes contradict a little bit some of the other ideas. But maybe in understanding that include and hope are for people with FASD and educate and community are for how to talk about alcohol and pregnancy, shock is for how to talk about women who consume alcohol during pregnancy. And so I think that that's a group that still is going to require a great deal of support when it comes to how we find ways to help them and destigmatize them so that they can get the help that they need. So I'm going to return a little bit to what we can do with shock and what shock might actually tell us about where the place of stigma could be in health communication. Although, like I said, I myself am a little bit skeptical that it will be the most helpful tool, and I'll explain why. So really, to wrap everything up, to connect the stereotypes to the news coverage to the things that my participants had to say, the first key take home is, like I said, we must include FASD stakeholders, not just in news coverage, but in drafting legislation, and not just in legislation, but in testimonials, in more intimate settings. I have a lot of participants with FASD who were saying, you know, I sometimes go to parent support groups so that I can come in there and say, I'm here, I can drive, I can do my taxes, I'm doing okay, your children's going to have some successes too, it's not hopeless. So we must include FASD stakeholders in all parts of life, and again, allow them to not just be objects of pity or objects of inspiration, but to be subjects in their own story. We must communicate more hopeful messages so that we can combat stereotypes like the victim and villain stereotypes. And again, there have been some truly excellent articles coming out in our media sample and in the last few years. So again, I'm not trying to say that this is a problem for every news story and every part of the media and every researcher and every healthcare professional. It's not. There's great work being done, and we can just push some of that a little bit further. We must ensure community-wide messaging and education so that we don't stigmatize and stereotype women who consume alcohol during pregnancy. So we can combat stereotypes about mothers so they can get the support that they need. So that leads up to that last question, but should we ever use stigma as a tool? And I don't know that I have the answer right now. I think that's something that is going to require a great deal more work by a lot more people. But one of the things I want to highlight is that there is a serious tension between how we talk about alcohol and pregnancy and FASD in the context of prevention and how we provide supportive messaging, because everyone's on board that we need hopeful messages. But when we start to talk about prevention and using fear, sometimes the stigma from that fear-based message doesn't just affect women who consume alcohol during pregnancy. It could be something that radiates out to people with FASD. So let me just give you an example. That quote that I showed you before, fetal alcohol syndrome is an entirely preventable disability. That wasn't the whole quote, a little ellipsis in the middle. The whole quote is fetal alcohol syndrome is an entirely preventable, potentially life-destroying disability. And so in this one quote, you can see the way that prevention messaging and conversations about what FASD is like for people with FASD are combined. And what I can tell you is that every single participant I spoke to, with maybe a few exceptions, took issue with the idea that it's life-destroying or even potentially life-destroying. It's not, it doesn't have to be. And one of the key conversations that I had with my participants is, how can we improve this message if you don't like it? A lot of adults with FASD said, this makes it seem like I'm destroyed, like I'm nothing, but I'm not. I can do a lot of things. So combining a lot of their answers, this might be a better way to frame that message. FASD is not a life-destroying disability, but it is a lifelong disability. But with the right support, people with FASD can succeed. Thank you all so much for your attention.
Wow, John, thank you so much. That was outstanding. Really enjoyed that presentation. Enjoyed hearing, and you know, you really just got me thinking about some of these things. At Canada FASD Research Network, we're really motivated to be thinking about some of the science that's out there, and importantly, how are we messaging that information? How are we consistent nationally in messaging that information? And so we've produced certainly some issue papers and online training and things like that in order to do so. And as I listened to you, I felt really good, because I think as a network, we've worked very hard to think about our languaging and our approach to do some of the things that you're talking about, to say we want to look towards healthy outcomes. We want to be thinking about promoting hope. I know Dr. Nancy Poole has done a tremendous amount of work looking at prevention and really trying to think about the complexities that you're describing. So I listened to you, and I actually was cheering a few times, and my hands went in the air, and I said, oh, I appreciate that. We've recently at CanFASD produced a document towards healthy outcomes, in which we're really trying to reframe this conversation a little bit, much in the way that you sort of articulated throughout your presentation. We might be looking at a future webinar in that direction. Who knows? We'll see. But I just wanted to say a big thank you. And now I just want to turn towards some questions. And if folks have questions they want to ask John, if you want to just write those questions into the Q&A section, and I'll sort of work the way through them and toss them at you as we go here, John. Okay. One of the first questions, and I know I saw some of your references through the presentation, but if you don't mind just kind of coming back to it for everyone, there are questions about what you've published and how they might be able to obtain some of your work in that regard. Is it available? Can you give anyone some direction in that?
Yeah, so the focus group work has not been published yet. That's currently being submitted and under review, but the media studies have been published, and CanFASD a couple days ago, I think last Friday, published a blog post before this presentation that links directly to all of my published work on this, and I'd be happy to share that. And if you just have questions about the unpublished stuff, you can reach out to me, and I'm happy to answer that too.
Wonderful. Thank you. Your accessibility is wonderful. Another question that came in relates to your focus groups and some of your decision making around who is a participant in your focus group, with the professional groups, your choice around which groups to include. Did you include educators, or how did you make those decisions? And maybe I'll add in a little bit of, do you see any future for continuing to do this and things that you would add in or do differently as you go forward in terms of talking to folks?
Yeah, that's a really, really great question. So no, we did not include educators as a distinct category, and our thinking going into this, because we were so focused on the idea of diagnostic label, our initial idea was that it had to be healthcare professionals. We didn't even think about including social workers. We were saying it's got to be doctors, it's got to be nurses, and anyone who might have a direct connection to that in the healthcare context. As we started recruiting participants, we realized that there weren't that many people for us to talk to necessarily. There weren't that many experts who were doctors who had a huge amount of specific experience. So we certainly recruited some and talked to some, 100%, psychologists and groups of people, but we had to broaden it from healthcare professionals to healthcare and allied professionals. And that's where all the social workers came in. We didn't think about educators at the time, but knowing now what I know, which is mostly that almost all of my participants, especially caregivers, spent a huge amount of time talking about the challenges they faced in the education system, I would absolutely have included educators. That's something that we learned. That was a finding of the study that, yeah, we definitely need to talk to them too. So 100% going forward, I think there's some research there that needs to be done for sure.
It's always the nature of the work we do, right? You always look back and say, gosh, if I'd known then what I know now. I think that's why we have work ongoing all the time, right? Always new studies. Mm-hmm. Another question for you here, John, comes in and starts with just a thank you for a very interesting presentation. And she notes that she's very interested in the focus group data on diagnostic labels and wonders whether there is a value assigned to diagnostic labels, or if you could say a little bit more about that particular thing.
Yeah, so that's something that, first of all, in terms of publication, the first place that it is likely to be seen is probably ultimately going to be in my thesis as an appendix table. So all of the raw data will be there, hopefully, for you to see. But otherwise, that was a really, really interesting series of conversations. And some of the ways that I wound up categorizing it were, what were the reactions that people had, and how, like, to finding out that they themselves or their family member had FASD. And maybe unsurprisingly, the reactions that we heard were mixed. So, for example, caregivers reported simultaneous feelings of relief. I now know what's going on. I understand what's happening with my child. I didn't know what was going on before. I felt crazy. Now I have a name, I have a label, I have a diagnosis, and I can move forward. But also, sometimes the simultaneous reaction of sadness or being shocked or thinking, oh my God, what is this? Is this horrible? What do I even know about this? So a really mixed bag for some people. A lot of adults with FASD, at least the ones I spoke to, and maybe that's an important thing to emphasize, is that all the people I was speaking to were in support programs, were receiving support from social services, from health services. So a lot of them were the kinds of people who felt comfortable talking about their difficult experiences. So this probably isn't every possible experience that people can have or reaction that people can have. But most of them said something like, well, I was diagnosed as a kid and it's just always been part of my life. And so, of course, I had no reaction to it. It's just who I am. Others said, yeah, I was angry. I was upset. I didn't understand it because they were diagnosed as a teen or even as an adult. Again, the relief was present. Some people said, yeah, I knew what was going on with me and I was really happy to know what was going on with me. But maybe one other thing to highlight there, which was something reported by healthcare professionals who were saying, well, here's how some of my clients react to receiving the diagnosis if we don't communicate it with sensitivity, is that there was sometimes anger at birth mothers. And I did see that in some of my interviews, people saying, I don't like my birth mother, I don't like what she's done to me, I'm angry at her. And that's part of the label, is that it's not just a diagnosis that says, here's maybe how we provide support for people, or here's a path forward, but it's also something that looks backward. And it's something that says, here's the cause, and maybe now you have reason to feel certain ways about other people. And that's really difficult. And that's part of the most difficult, probably one of the most difficult tensions in giving a diagnosis of FASD. I don't know if that answers the question specifically of was a value assigned, but there were a lot of different complicated answers and reactions. And if you want to send me an email, I'd be happy to follow.
Wonderful. John, that's outstanding. I'll go to one more question here, and then we'll wrap up. Not that the questions all have to stop. John has really generously made his contact information available, and we also have our CanFASD information available for continued questions. But one last interesting question here is somebody who again wanted to thank you for your presentation and indicates they're wondering a little bit more about interactions with adoptive parents caring for children with FASD, and asking a little bit about what some of the most prevalent narratives are in supporting their children.
Yeah, that's a great question.
Yeah.
So given the way that we structured the interviews, really the only way that that might have come out was in the personal narrative section. And I will say that when talking to different groups of people, when I would say, tell me a bit about yourself, the group of adults with FASD would give me, a few quick sentences, and that was that. The healthcare professionals might say, here's, some of my expertise, and that's that. But the caregivers had the most detailed stories to tell. And I think some of it is that they just really wanted to share those stories. And some of it is because while their child with FASD, might be growing up, might be an adult now, and might have their own experiences, a lot of the challenges that parents have talked about are specifically their need to advocate on behalf of their children. So there were a lot of narratives of, like I said, the school system came up a lot, and we didn't realize that would necessarily be the case. But feeling unsupported by teachers, or maybe there was often this narrative of the one truly fantastic teacher who really got it, and then grade 4 comes and you're back to square zero with a new teacher. So schools not getting it, schools being under-resourced and not being able to provide the support even when they do get it, and really just a lot of conversations around advocacy. But there were also a lot of stories around their kids' successes and the things they're happy about. The fact that, some new parents wonder, will my child ever be able to do anything, like came up in the stereotype section. And, they would talk about like, yeah, absolutely, my kids drive, or my kids are doing things. They did tell stories about their kids in jail, about their kids struggling with substance use and those major challenges and behavioral challenges. So of course it was a real mixed bag. But I think really the thing that came through the strongest was the advocacy and the love for their children.
Wow, that's powerful. Awesome.